Hi, everyone. If you can hear me, raise your hand. Hi, everyone. I am not Dr. Kuzmerchik, who was supposed to introduce Dr. Porter today. I'm Deborah Livney. I was introduced before, and I had the privilege of engaging with Dr. Porter a few years back when she expressed her vision that we need to create a cross-border health innovation corridor between Windsor and Detroit in order to help the innovation get from the lab to the market, from the lab to the patients. Lisa is Dr. Lisa is a brilliant academic who used her entrepreneurial spirit to advance health innovation in a region to the benefit of all. Let me tell you a little bit more about Dr. Porter. She's a professor at the Department of Biomedical Science at the University of Windsor. She began in University of Windsor in 2004 after completing her postdoctoral fellowship at the University of California in San Diego. Lisa is a cell molecular biologist with an interest in understanding how cells grow and divide and what can go wrong during normal process to cause disease like cancer. I was once in her lab, amazing place. Her cancer biology interests have expanded over the years at the University of Windsor to involve the study of breast, brain, liver, prostate, and specific blood cancers. Lisa was one of the founding directors of the Windsor Cancer Research Group, an assembly of local researchers, clinicians, doctors, community partners, with focusing on strengthening local cancer research and bridge collaboration with cancer treatment centers. And that's how she got to the cross-border idea. And this group is now part of a larger effort to unify the area's health research in Windsor-Essex area. And that includes the two hospitals, the college and the university. And it's called We Spark Health Institute. It was launched in 2020, just before the pandemic. Lisa is currently the executive director of We Spark. So Lisa is a visionary leader of our community, and we really would love to hear what you have to say, Lisa.
Thank you, Deborah. Hopefully everyone can see me here. So I want to thank Yvonne and the organizers of this event for giving me the opportunity to come and speak to everybody today. And I, of course, want to acknowledge the great work being done by We Tech Alliance. Over the years, they've really increased the opportunities and supported the successes of innovators across our region. So thanks to all of you, and it's really my pleasure to be here today. So as you heard from Deborah, I'm a cancer researcher. My passion is really about finding new and better ways to improve the journey for cancer patients across a spectrum of different forms of cancer. But what I'm going to talk to you about today is not about my research or my vision alone. It's really about the product of the vision and hard work of many individuals from across our region, some of whom are retired now, some who continue to work with us to move health research forward in Windsor-Essex. I want to start out by stressing the importance that health research brings to society, to healthcare, and to our economy. So for health research, many of you may know, but maybe some don't really think specifically about what health research brings to our society. So health research, of course, naturally brings expertise around the table to meet our most pressing challenges. We're seeing that right now with COVID. And in doing so, that aids in acquiring cutting edge technology, but also helping us in developing new technologies and moving those forward. Health research naturally becomes a breeding ground for world-class training environment. And that also just sort of spills forward in our environment to really create an exciting environment that's grounded in excellence and grounded in knowledge. And it's that kind of environment that attracts and retains the best and the brightest in healthcare to our region. That then really does support our economy and our community. It aids in bringing the latest diagnostics, treatments, and therapies to patients here in our region. And by having health research happening at our hospitals, that allows those hospitals to adopt the best prevention and care practices first. Collectively, that for patients, for students, for the community, provides an environment of hope and empowerment. There is actual data that shows that patients treated at centers that have active health research live longer. And that stat alone is such an important deliverable to bring to our community. And it doesn't stop there. For business and the economy, we know that health research can find alternative mechanisms, say for developing funds, to bring funds to the table to develop new innovations. By bringing those expertise and experts around the table, that sort of naturally points out and identifies what the market and what customers need the most. And that training environment provides access to business to the most highly trained individuals, and it keeps the workforce current, which is very important. It also finds better ways for businesses to reach their market when it comes to healthcare. And of course, it naturally brings people around the table that are eager and capable to advance your ideas. So health research has many deliverables to a variety of different stakeholders across our community. It goes without saying then that we need health research right here in our community. At the time when we began this project back in 2009, there was no supported effort to truly grow health research within Windsor. We were, of course, butted up against some giants in the field. To the north of us, Detroit, Upper Michigan, with Wayne State, Henry Ford, Karmanos, Michigan State, and the University of Michigan. And then to the east of us, of course, the University of Western Ontario and the Academic Health Sciences Centers in London. It is probably not hard to visualize which side of the fence we were on here in Windsor. And well, there is great advantages, of course, to bringing together our strengths. And this is our ultimate goal. Windsor-Essex first had to gain its own identity and strength in the area of health research. In order to truly be a partner that could actually benefit our region, we had to step up our game and really figure out who we were and how we could bring together our strengths within our region in order to meet those of our partners. So this is where we started. And we were lucky to bring together the four WeSpark organizations that each bring to the table their own strengths and are guided by visionary leadership. Each of these individuals see the promise in our region and truly believe that we should settle for nothing short of excellence. The University of Windsor, of course, brings to the table expertise for supporting research and already had world-class health research that was embedded in every faculty across campus. Hotel de Grace Healthcare is a community-based hospital that truly is a powerhouse for patient-centered, value-based care. It uses research on a regular basis to provide care in new ways and to improve the way that they're providing access to treatment and in how they're delivering that patient experience. St. Clair College, some of you may know, is home to one of the largest health sciences programs in the province and is using research regularly to provide students with work-ready skills while forging really the community partnerships that they really need for their students to go off into that workforce. And Windsor Regional Hospital, it's the 11th largest acute care hospital in the province, and it was already making strides towards becoming an academic health system that supports cutting-edge research, education, and care across a range of disciplines. So collectively, these four institutions on their own were strong and they're continuing to grow, but coming together has amplified that potential. And we are only just beginning to see what we can accomplish as a group. So as Deborah mentioned, our journey really officially started May 1st, 2019. We weren't yet branded as WeSpark. And then we were chartered to become an official institute under the University of Windsor later that month. We then continued over the next few months to really continue to do an environmental scan, consult with members, which we are constantly really appointing towards our advisory committee, but really using these stakeholders and consultants in the community around and within our partnerships throughout the region. We added this data to sort of a decade of data that had been accumulating, and then pulled together an executive committee. And this executive were largely partners within our four WeSpark organizations. And these individuals had to take off their independent institution hats and really sit down and think together about what we wanted to create as a region, who we wanted to be, what are our strengths, and where do we want to go with this. And then in February, we branded officially as WeSpark Health Institute. And then we launched, as Deborah mentioned, in March. And of course, we launched right as COVID was shutting the province down, essentially. And our first year ended April 30th, and we put together this impact report, which is available on our website for you to look in detail. I'll cover a couple points with that in the next few slides. And then now we've started so that we are reporting quarterly within now moving forward. And our first Q1 of year 2 is also available on our website. So just a little bit about who WeSpark, who we are. Our mission is to enhance the health, the health, well-being, and care of people through transformative research and knowledge translation. And our vision is a thriving, engaged research community driving advancements in health. We have 5 strategic priorities, and we have committees that are the working piece of who we are, that are structured around each of these strategic priorities. And each of these committees brings to the table our 5 working values. And you'll notice that innovation and excellence are 2 of the values that we embed into everything that we do. And so a little bit about our structure. We are, as I mentioned, we have an advisory committee, which really did help sort of lead us in the beginning. This advisory committee continues to pull upon experts from our surrounding partnerships within the region. And we really keep adding to that advisory committee and relying on them at an ad hoc basis. I know some of them are on the line now. And then we have our committees, which really are structured around our strategic priorities, and they are the working pieces of who we are. So we have our research development committee, moving forward research excellence, our nucleus committee, which is our committee focused on building capacity, our governance committee, which are focused around organizational effectiveness, and then we have a knowledge translation committee and a community engagement committee. Each of these committees are chaired by a member of this executive committee, and on the executive, we have 2 members from each of our WeSpark organizations, and they are really an approval board that approve all of the recommendations moving from our committees that then move through me as the executive director to our board of trustees, which has the lead and sort of the top office at each of those 4 partnering, or each of those 4 organizations. And then the main body of WeSpark, our WeSpark office, and sort of the engine of who we are, our assistant director, Karen Metcalf. And our office has is growing readily. So we have a translational research associate, Kyle Lago, our administrative clerk, Marla Rivard, our part-time communications coordinator, Kathy Mombaquette, and then newly appointed part-time knowledge translation research associate, Adriana Baggio, and then our newly appointed intern, developing a volunteer network, and that's Ryan Palazzolo. And really this, our staff is really a lot of the working body that's supporting these committees. And so in the next few slides, I just want to tell you a little bit about some of the successes and the milestones that each of these committees have set up, and give you a little bit of sort of high level idea of what we're working on. And so working on research excellence, our research committee has set up some of the milestones in year one and moving forward into year two. They started out profiling and tracking successes of our core membership, growing our membership, which I'm going to tell you about on the next slide, hosting a WeSpark grants competition, developing a central hub for research processes and system navigation, addressing a need for a regional research ethics board, and consulting and supporting what we call our WeSpark affiliated programs. And so a little bit about our membership, and I wanted to invite you all to look to our website and invite you to join us. We have really membership categories that are of interest to many different people. So we have a student membership, community membership. We have WeSpark ambassadors, who are people that are supporting us through donations, and affiliate researchers, who are researchers, health researchers outside of those four primary WeSpark organizations. And then we have our core members whose primary affiliation is one of our four WeSpark organizations. And our core memberships really are divided up into two different pathways. One are our principal core members, and these are members who hold either provincial, national, or international funding, or are leading a clinical trial. And then we have associate core members who really are members who are maybe new to the game in health research or research as a whole, but are really interested in growing themselves as health researchers. And just to show you a little bit from year one for our core members. So we have 19 principal core members in year one. We already have moved one of our associate core members up to a principal core member more recently. But within year one, you can see that these core members brought in over $6 million of external grant funding and have had a lot of really impressive successes, including running a number of clinical trials, publishing peer-reviewed papers, leading collaborations, winning awards, etc. One of the things that we do within the research committee is really think about how we can support the excellence of these core principal members and continue to grow their research programs, but also looking to our other 73 associate core members who are hot upcoming health researchers, and what we can do to really bring them up to being core principal members with their own active research programs. And one of the ways that we do this is through our grants program. So we launched 3 different types of grants program, a seed funding program, which is really about taking early stage ideas and providing them with some funding in order to get those ideas moving. A bridge grant funding, which is really taking grants that our members have written that are provincial, national, or international grants that have just fallen short of funding, and give them the funding that they need to get those up to being those large funded grant programs. And then we have an equipment and infrastructure grants funded programs. So while each of these funding programs need to be led by one of our core WeSpark members, they can include teams of researchers that are moving them forward. You can see that in year one, we were able to support 29 grants involving over 100 different researchers from over 24 different collaborating institutions, and equaling over $400,000. And really thanks to many of our generous supporters that allowed that grants competition to happen. One of the competitions that we were really proud of and supported sort of the majority of our grants was this COVID rapid call that we launched right out of the gate. And so right after we launched as an institute, our grants committee worked hard to launch this, our seed grant program. And then we were able to make a call for COVID grants early in April and fund 21 of those grants by the end of the month. And of those 21 grants, that represented 20 partnering organizations around our region and over 100 different researchers. Our staff also launched a COVID-19 resource hub that included the resources that were being provided by our 4 WeSpark institutes, or institutions, but also many of our different partnering organizations within the community, such as the public health. And so we really focused on being sort of a central hub that could bring together all of the different resources that people were trying to get out there. And this is still an evolving resource. So if you want to take a look at it, make use of it, and also, of course, feel free to send us your resources or ideas for that hub. Another thing that we look to do, similar to WeTech, is finding ways to mobilize ideas through different kinds of events. And example of those events is we hosted these COVID conversations, which are moving forward into other kinds of health research conversations, such as cancer conversations and other types of health conversations. This was really taking research ideas and finding ways to discuss those early stage ideas and discuss them as they were moving forward. We also have sort of a pride and joy of ours is our program that we call the think tanks. We offer these every second month, and anyone is welcome to join us. And we have one tomorrow, so it's not too late to join that one if you want to look to our website and sign up to see what the think tanks are all about. Think tanks have really been pivotal in us taking ideas and moving them forward, coalescing teams around those ideas and getting actionable items, which really have helped our researchers bring forward a lot of big successes. We also have prided ourselves on becoming a central hub for health research for our region. We have what we're calling the Uniting Connections Collaboration Platform. And this is in early days and it's still evolving, and we're looking to researchers to help us in the development of this, but it already has helped bring a lot of researchers and collaborations forward. And so you can look to our website. This really is about telling us what kind of collaborations you're looking to form, what kind of research tools you might need, whether it be equipment, resources, etc. And so look on our website for this collaborations platform. We also have a research registry on our website, which allows us to post different kinds of research studies, which are looking to accrue either members of the community or looking to gain accrual from other researchers or other partnering institutions. And this research registry continues to grow as well. So if you have questions, please contact us. We also look to support other affiliated programs. And so we knew that when we started that, we didn't want to take over other areas that were already showing success. And so other groups and other areas that had successes with research, health research. And so what we wanted to do was really set up a platform where we could support those groups. And so one of the things, and these are just showing you different ways that we support our affiliated programs. So one is we help them facilitate connections. So we make sort of our affiliated programs some priority areas for events that we're hosting. We also provide them with support in hosting their own events. We have been able to provide some priority funding calls to some of our affiliated programs and provide our affiliated programs with website support and support for data sharing. We've also looked to our affiliated programs to ask them what they need with regards to knowledge translation. And so we're able to really start moving forward in providing sort of novel training programs that will help their programs succeed. And then also asking them, what kind of knowledge translation tools would they like to see developed? And we've been able to move forward with developing some tools for them. We also look to support them with the metrics that they need to collect to be successful. We profile their researchers on the website, help to highlight their successes in our newsletters and on social media, etc. So currently we have 4 affiliated programs: the Windsor Cancer Research Group, the Center for Human Health, or Human Performance and Health, the Great Lakes Cardiac Rehabilitation Consortium, and the Windsor-Essex Compassion Care Community. And so please contact us if you want to discuss emerging programs, networks, and look to our website if you want to learn more about these amazing programs. So from our knowledge translation committee, so of course, knowledge translation is really taking the research that is currently ongoing and finding ways for us to move that knowledge forward to inspire and drive change. And so this committee has had a lot of different priorities. 4 of them I'm highlighting here. So one was to develop a student network. And so we have Ryan leading this student network as an intern. We are looking to support novel training opportunities in health research, and I'll highlight 2 on the next slide. We are looking to be a central resource for developing a variety of different knowledge translation tools. And then we set out to sort of keep our members informed. And so we launched what we call the Spark. It's a members newsletter. And within our first 2 months, we had already sent this newsletter out to over 400 individuals amongst our membership. And so within our first 2 months, really, we launched 18 different knowledge translation tools that supported many different trainees in our community. And we hosted 7 different educational events. You can look to our website to see this one brainstorming event that we hosted that really showed some novel ways that we could use online tools to support learning amongst our members. We also have been working with our Schulich partners to provide ways to support medical student trainees within the Windsor-Essex community. And then we have launched a Master's of Translational Health Research program through the University of Windsor, which is supporting clinical research projects. And so both of these ideas are continuing to evolve, but will be ones that really are important for supporting our researchers. And then for community engagement, we have launched this Ask the Experts series. It initially launched around the questions that the community had about COVID. And we're looking to expand this Ask the Experts series into other areas of health. We also, through our communications person, have really been very active in launching our website. And so that website launched in March. And you can see very quickly gained a number of unique website visits across not just Canada, but internationally. And we do have a very active presence on all of the social media platforms using the same handle at WeSpark Health. So please look us up there. And we have a community newsletter that in the first 2 months went to over 800 individuals. And so when you sign up to be a community member, you'll be delivered that newsletter. And then with regards to building capacity, this is a group that we call Nucleus, which stands for Network of Core Labs Enabling Solutions. And one of the things that Nucleus does is really collect an inventory of what kind of equipment and core labs that we have locally already ongoing, and then what do we need moving forward. One of the things that they've been very active in looking at is how WeSpark can be a central resource for data sharing. And so we very quickly got a license for RedCap as a central license. And we right now are able to support centrally the IT capacity and training on RedCap. We also are looking to really facilitate some large infrastructure and capital build plans within our region, in collaboration, of course, with our hospitals. And so just in some final, just moment to call to action, I invite you to go to our website, become a member. We're happy to promote your health events. Please keep an eye on our successes and feel free to brag about us on social media. I'm really happy with how things are going, and I hope that you would be impressed as well. And so in short time, WeSpark has really come together to form a one-of-a-kind unity between our university, college, and 2 primary hospitals. This unity really sets us apart from others. And as many of you know on the line, Windsor-Essex has a strong sense of pride in being homegrown. This is truly a homegrown project that has vision and is really looking for the future of our region and healthcare in our region. And so we're looking forward in year 2 to building upon this foundation and working with you and coming to the table as a partner to meet our healthcare challenges that define us as a region. And our tagline for year 2 is achieving more together, and we look forward to that. And so I know I'm out of time, and I don't know if we have time to answer any questions. So I see in the chat that somebody asked about the think tank, and they asked if there's any geographical requirements for the think tank. Oopsie. Sorry about that. And no, there's not. So anyone is happy to join us. We're happy to bring to the table. Oh my gosh, I'm sorry. I'm trying to move over this window. But please, join us in Think Tank. We are happy to have any of you. So do you envision a WeSpark cross-border collaboration? 100%. So WeSpark really is, as I mentioned in the beginning, it's about strengthening Windsor-Essex with regards to health research. But one of the major goals of that was to allow us to be a strong partner for our cross-border partnerships. And all of the programs that we mentioned, and even the teams, many of our researchers are looking to develop teams. And so the expertise that's on the line right now, individuals from around the region, please, we have many researchers who would be very happy to work with you moving forward, for sure.
Eric, would you like to introduce yourself?
Hey, everybody. Really delighted that I could, really excited actually that I could catch the latter part of Dr. Porter's presentation, which is just remarkable seeing how far WeSpark has really come in the last little bit. And I'll be honest with you, I am convinced that Dr. Porter is cloning herself secretly in her laboratory, because there's no way that one person can do so much, and just wanted to say how commendable that is. Everything that you're doing, both your work in your laboratory, but also in terms of building a community around WeSpark, and on this side of the border. I just wanted to say hello to everyone, and just wanted to remark how absolutely remarkable it is as well, how far we've come as a cross-border community, working on health challenges and the collaboration that really is taking place. If COVID has taught us anything, it's that health challenges really do not recognize borders. They don't respect borders. And quite frankly, neither should our solutions and the way that we arrive at solutions to the challenges that we're facing. And so really hats off to WeSpark, hats off to MedHealth, the tremendous work that MedHealth is doing as well to serve as bridges on both sides of the border. And I think what's going to be critical to the work as we continue is to make sure that we continue bringing more partners on board, and really continue bringing not just public sector partners, but private sector partners into this work, and making sure that both the federal and provincial governments are also engaged deeply in the work that's happening here, so that we can to use a proverbial word, to take the next step. So with that, I don't want to take away any time from the excellent discussion that's taking place, but I really just wanted to commend the organizers of this day for, again, serving as a bridge, and the work that you're doing. So thank you very much.
Thank you, Eric. And I don't know if I have time to comment, but I do want to say that I think one of the big things that we have recognized is obviously that we do have our unique challenges in Windsor and Windsor-Essex, and how we're sort of communicating with our partners to both sides of us and across the border. And with COVID especially, we've seen that the government has particular interest in our area, because even with our unique demographics, it's represented its own challenges. And so I think this also speaks to the importance of us really gaining momentum with regards to research. I mean, we need to have that research infrastructure in place, and we need to be strong in order to be able to address the challenges that come to us. And our region is important. And I think that that's what's we're seeing right now, even opening the border for COVID. It's going to take new solutions, and that requires research. And so, this is something that right now we have a lot of researchers focusing on at WeSpark, and this is an area for sure that we're happy to work with different partners on, certainly.
Thank you very much, Dr. Porter and Dr. Kuzmarchik. This was amazing. What a great combination.
Thank you for having us.